Hi, my name is Ashley Fennessy, and this is the evolution of nursing informatics. Nursing informatics is a specialty of nursing that involves combining the science of nursing with technology in order to improve patient outcomes. This can be done by developing and optimizing the use of the electronic health record and the health information systems to create a more streamlined process. The use of data and technology are intended to support nursing care while also enhancing education and research. The use of information technology in nursing facilitates collaboration and communication amongst providers and ultimately promotes patient safety. Technology in nursing informatics fosters safer patient safety outcomes, an environment of quality care, and efficient practices for nurses and other healthcare providers. Computers were not introduced to nursing until the 1950s. However, some historians note that nursing informatics can date as far back as the days of Florence Nightingale, when she collected and translated data to improve sanitation and medicine. In the 1980s, several professional nursing organizations emerged to form a task force on nursing informatics. Then in the 2000s, technological advances had influenced healthcare into formulating the electronic health record and health information technology. Nursing informatics continues to develop today and is patient-centered, focusing on accessibility and ease. Nursing informatics is also data-driven and continues to utilize evidence-based practice to produce quality care and increased outcomes. Nursing informatics has evolved towards patient-centeredness by utilizing technology for ease of access. Additionally, health information systems have developed to engage patients and increase patient involvement in their own health with systems like telehealth. The focus on patient-centered care has facilitated holistic care where a patient can meet with a healthcare provider via an internet platform to discuss any medical or mental health issues. The electronic health record, which emerged in the 2000s, has now streamlined healthcare so that multiple healthcare providers can efficiently deliver care to the patient by having the ability to view their medical records through a computer. The electronic health record is not only utilized for the documentation purposes, but can also be used to share data to track reimbursements for healthcare administrators. Nursing informatics has positively affected nursing workflows to allow for a streamlined process and alleviate nurse leaders from the burden of appropriately staffing departments. Health informatics systems have developed programs by using artificial intelligence and utilizing documentation from the primary nurse to predict things like acuities, which can be used to help staff a unit safely. With nursing informatics, nurse leaders are given the opportunity to make informed decisions by using data and analytical tools in order to allocate resources. Nursing informatics also offers support to nurse leaders with scheduling tools and programs that can be used to ensure compliance and performance monitoring. Nursing informatics in clinical practice is not limited to the electronic health record. Nursing informatics supports clinical practice through the use of patient monitoring tools. Nurses are able to remotely monitor multiple patients at once and can collect data like vital signs and lab results that are quickly and efficiently transferred to the computer to be shared among the healthcare team. Nursing informatics has also affected clinical practice with the development of barcoded medication administration tools that are aimed at preventing medication errors. These tools are intended to be used in addition to traditional nursing care in order to administer the correct medication and dosage at the right time to the right patient to prevent adverse effects. Informatics has also had an effect on nursing administration by allowing administrators to efficiently track resources like staffing, organizational census, and the use of equipment. Programs are used to track patient flow and bed management to help administrators optimize bed utilization and improve patient flow. This can also allow for shorter wait times for the patients and can help to ensure that appropriate care is being delivered. Similar to nurse leaders, nursing informatics allows administrators to track organizational compliance to ensure accreditation and meet regulatory standards. This streamlined use of nursing informatics allows for strategic planning for the administrators to develop long-term goals for their organization. Simulation labs and virtual learning environments have allowed students to practice scenarios in a controlled setting before venturing out into the real world. This type of nursing informatics allows students to develop their critical thinking skills and decision-making abilities in a safe place while mimicking real-life situations. Nursing informatics also gives students the chance to test their clinical competence in a simulated exam that is similar to the state board, which gives students the opportunity to grow accustomed to the testing environment. Students also have the opportunity to explore and practice on simulated electronic health records so that they become familiarized with the technologies used in clinical practice. Data collection and analysis were at the forefront of nursing informatics. Nursing informatics helps to facilitate patient data collection for research purposes, which allows researchers to generate trends and patterns that might help with patient outcomes. This same data can be utilized towards formulating evidence-based data. Nursing informatics provides the tools and access to research that can be used to create best practices. This data can be translated into clinical practice to improve the quality of care that is delivered and can ensure proper implementation of interventions. This effect on research can foster a collaborative environment between healthcare providers and ensures positive patient outcomes. The progression of nursing informatics has led to the need for organizational policies on health information systems. During the COVID-19 pandemic, to efficiently increase access to healthcare, many of these policies that were in place to ensure patient privacy became a little more lenient. This meant that programs that were initially not intended for healthcare use emerged as platforms for telemedicine, and regulations for these platforms were not yet in place to ensure patient privacy. Organizations must comply with government regulations such as HIPAA to protect patient data. Any non-compliance from this safety standard could result in hefty fines and even legal consequences, including termination. Health information systems can also be impacted by cybersecurity policies that prevent organizational data breaches. Nurse-led innovations have led to advances in informatics and improvements in the quality of care. Nurses have contributed to advancements in informatics with customized patient education and care plans. Technological tools are used to create these personalized care plans that address the patient's needs, conditions, and diagnoses that lead to positive outcomes in patient care. Nurses have also helped to develop innovations that have led to advancements in remote monitoring and telehealth care. This has led to an increased accessibility to healthcare services and enables patients to engage in their own health. So one scenario is the ICU nurse has been tasked with monitoring the patient with severe ARDS secondary to COVID-19 pneumonia. This monitoring requires collection of data that includes vital sign monitoring, ventilation, and oxygenation monitoring, lab results, and medication administration. This data is transferred to the computer outside of the patient's room for remote access to prevent unnecessary visits to the patient's isolation room and misuse of resources while the patient has an active COVID-19 infection. The data is used to drive the patient's care. For example, the results of an arterial blood gas are used to titrate the paralytic sedation and ventilator settings for a patient with respiratory acidosis. This data is communicated to the healthcare team that includes the physician and respiratory therapist that controls the settings on the ventilator. Another scenario is the FNPS tasked with diagnosing a patient with a high blood pressure. The nurse first collects the data and inputs it into the electronic health record for data analysis. This data is used to identify trends and patterns that will help the nurse to administer the appropriate care. The nurse can also use the data to personalize a care plan for the patient that includes customized education. For example, the nurse is able to determine that the patient's blood pressure is typically elevated after consuming a meal high in sodium. Continuous monitoring is used to provide the patient with the appropriate diagnosis and medication regimen and ensures that the patient has the appropriate follow-up. Here are my references, and thank you.